The first position we all have is in the mother's womb, so it's the fetal position. And the spine has the C-shaped curve which goes from head to toe. As we become upright, we develop the secondary curves in the lower back and in the neck. The first 2 joints in the neck are designed differently from the other 5, so there's 7. And where the skull sits on the top, number 1 and 2 are designed to have 40–50% of rotation. What happens if the head moves forward is the heaviest part of the body. It weighs the same as a bowling ball. If it drifts forward gradually, the spine follows and straightens. The coupled movements are altered in the neck. The top 2 joints tend to be restricted, and when something's stuck in the spine, movement is always found somewhere else, and it tends to happen midway down the neck. Later on, what we tend to see as chiropractors when we look at x-rays is a reduced space between the joints in the middle of the neck. If you can see here, the first example on this row shows that the curve is going backwards. As that head drifts forward, it carries the spine, straightening it, and then those couple movements change and alter, so the first 2 joints tend to become stiff. Things like looking over the shoulder in the car, one thing that you'd notice is restricted, and in the middle of the neck you get reduced space between the joints. When we look at the lower back, this is an example of a good curve in the lower back. The black part represents what a disc space would be looking like. This picture depicts it and shows it very well. And this example here shows a tear in a disc. The ideal curve should be like this, gradually with gravitational pressure and wear and tear, and things that have torsion but the discs don't handle very well, we can get reduced space, as you can see here. Added to that, the bones themselves can become degenerative and develop these osteophytic spurs. So we can see sharpened edges on the front of the end plates here, off of the anterior or the posterior part of the vertebral bodies. If it goes into the back where this intervertebral foramen is, the gap where the nerves exit, it can compromise the effectiveness of the communication between the central nervous system and the organs and glands and cells and tissues of the body. So there are 2 major things that can happen with degeneration and with wear and tear in the discs and in the bones. We get the osteophytic degenerative spurs that can cause problems where the nerves exit. We can also get those discs that can bulge and cause symptoms like sciatica. What we look for when people come in with sciatica are things that would mark whether it may lead to further scans or imaging. So 2 of the things that we want to eliminate are disc problems or occupying lesions, space occupying lesions from bone. There are several tests that we do when you come in for an assessment in order to help us deduce what it is being caused by. When we look at reflexes, we're looking to make sure that both sides of the lower extremity or upper extremity, when we're checking for them, where we're checking, are exactly the same or very similar. If there's a discrepancy, it can lead us to what we call a red flag, and there's an alarm bell to think maybe we should be checking something else. We check sensation, make sure that that's the same bilaterally, upper and lower extremities. We check for other pathological reflexes. Then we move into orthopedic testing, specific tests to help us evaluate and confirm what we've learnt from history and through observation and through testing of reflexes, muscles and sensation. Once we've done that, we'll come to the diagnosis part. In the diagnosis part, we'll explain in a similar vein and fashion to as we have now, to give a patient a more detailed understanding of the sort of problem they've got, how we go about tackling it, whether we need to offer them the opportunity to have more scans, and then from there we'll move into a plan of attack for helping them get rid of the immediate symptoms and preventing the problem from getting any worse.